Hi guys, it's always a pleasure to speak to you. It's always an honor just to come to you and speak to you. My name is M. Moody. I'm a medical imaging and diagnostic radiographer with a special interest in ultrasound. This morning, I will just want to speak about imaging in the last trimester, in the last 3 months of pregnancy. And I would like just to run us through the reasons why we need to do scans during this particular time. One of the reasons is to check the presentation of the baby, how the baby is presenting. Is it presenting with the head, or is the baby presenting with the feet? That is bridge presentation or cephalic presentation, or the baby in transverse lie. The second thing that we want to look at the weight of the baby. How is the weight of the baby? Is the baby small? Is the baby big? We also want to look at that. So at the end of the day, we need to ascertain and approximate the weight of the baby. The third thing that we'll want to look at is the loop, where the position of the umbilical cord is. Is it looped around the neck? If it's looped around the neck, is it tight or is it loose? Is it one loop? Is it two loops, or is it three loops? And even if there's a loop, is there a knot on the umbilical cord? Because all those things will affect the blood flow between the mother and the baby. We'll also want to look at the placenta, look at the maturity of the placenta. Where is the position of the placenta well? We'll also want to look at the maturity. Is it in tandem with the gestational age? We'll also want to look at the cervical region, in the internal cervical region. We want to make sure that the cord is not there, what is not low lying, what we call vasoprevia. We'll also want to look at amniotic fluid, just make sure that at least the amniotic fluid is also it's adequate for the age. We'll also want to make sure that there's no premature rupture of membrane, especially with those mothers who come with the drainage of the amniotic fluid or drainage of liquor. So at least when you go for a scan during this particular time, those are some of the reasons, some of the questions that that needs to be answered immediately after you have done the scan. Always make sure that you try to ask the person doing the scan, what is the weight of the baby, where is the presentation, how is the amniotic fluid, and is the cord looped around the fetal neck or is not looped around the fetal neck. So at least at the end of the period, at the end of the scan, those 3 questions at least should be answered. So at least now we have known the reason why we need to do scans in the first 3 months, the second 3 months, and the third 3 months. So when you conceive, when you're pregnant, my advice is get time, go to your healthcare, have at least scans done at least 3 each in every 3 months, because our prayer is at the end of the 40 weeks, when all is said and done, our prayer is we'll have a normal pregnancy, we'll have a normal baby coming out, so that all of us, we are going to celebrate even as this baby comes out. Thank you very much, and I'm looking forward just to speak to you next on my next topic. Always look forward for the next topic that I'm going to release. My prayer is that even as I speak to you, even as I talk to you, we get more enlightened. As I speak to you, I learn and you also learn, so that we can make our society better. We can make our society a better place to live in, a better place to interact, a better place to have knowledge, a better place to share knowledge. Thank you.